You will now see more mobile clinics in places like workplaces, childcare settings, and schools. Toronto is expanding its targeted COVID-19 vaccine strategy. Mayor John Tory wants to see as many people vaccinated as possible ahead of fall.
The expansion will provide Toronto Public Health the capacity to host up to 200 mobile clinics each week, in addition to the clinics currently run by Team Toronto and healthcare partners. This, of course, is made possible by the fact that we have reduced to some extent the number of permanent mass vaccination clinics operated by the city and redeployed those resources to this mobile effort.
Mayor Tory says the data-driven approach will bring vaccines to residents in areas that have low vaccination rates or where there's a higher risk of contracting COVID-19. Torontonians will find clinics anywhere from places of worship to grocery stores, parks, and recreational facilities, a strategy the city says works.
Roughly half the vaccinations administered at our clinics and TTC stations last week were first doses, which means there's a need out there for these types of clinics for people who just haven't gone even to get that first dose.
Nearly 17% of Ontarians 12 and older haven't received their first dose, and nearly 24% haven't gotten their second shot.
Since May the 1st, in this city, the City of Toronto, 98.7% of hospitalized COVID-19 cases with known vaccination status were people who were not fully vaccinated.
The timing of this hyperlocal mobile strategy is key.
The most effective thing we can do in support of the school year is to get vaccinated.
The city says starting this week, they will focus on 3 specific age groups: 12 to 17, 25 to 49, and those who are 65 and older in neighborhoods with high numbers of unvaccinated people. City Councillor Joe Cressy says for the majority who still haven't rolled up their sleeve, the issue remains access, not opposition.
Many Torontonians still face barriers or questions that we're working to overcome, from mobility issues and language barriers to transportation access and technology challenges. Some people don't have an ID, and many frontline and staff and shift workers don't have the time.
While the city is focusing more on their vaccine mobile strategy, there are still 5 mass immunization clinics running across Toronto. There's no timeline on when those will be closed.